Hi, my name is Liliana Barrios, and I'm here to present our work, a rapid tapping task on commodity smartphones to assess motor fatigability. This work was done in collaboration with my colleagues, Pietro Oldrati, David Lindlbauer, Marc Hilty, Helen Hayward-Koennecke, Christian Holz, and Andreas Lutterotti. This is a collaboration between ETH Zurich, the University of Zurich, and the University Hospital of Zurich. So let's start. Fatigue is a common and debilitating symptom of many autoimmune diseases, including multiple sclerosis. Up to 95% of MS patients complain about fatigue. Despite being a highly prevalent symptom, fatigue is still poorly understood. So, fatigue, in the clinical sense, is defined as the subjective lack of physical and/or mental energy that is perceived by individuals or caregivers to interfere with the usual and desired activities. Fatigue is currently assessed through questionnaires, like for example the Fatigue Severity Scale. This is a questionnaire with 9 statements that the patient have to rate from strongly disagree to strongly agree. The final score of this questionnaire is the average of all the answers. So there's a limitation with questionnaires, and this is that they are subjective, and occasionally they ask patients to make difficult retrospective analysis. These limitations hamper the development of treatments and our understanding of fatigue. So how can we objectively measure fatigue? Fatigability, the objective decline in performance over time, might be the answer. So a number of recent articles have found an association or have shown an association between motor fatigability and subjective fatigue in multiple sclerosis patients. However, there are some inconclusive results, and this is mainly to the lack of standard and readily available methods to assess fatigability. So, motor fatigability is currently assessed through methods like the Handgrip dynamometer, 6-minute walk test, and the knee dynamometer. By using a dynamometer, basically what we're measuring is the decline of strength as time progresses. So there's a limitation with these methods, and is that they require specialized equipment and trained personnel to conduct the test. Therefore, finding ubiquitous and inexpensive ways to measure fatigability could be beneficial for our understanding of fatigue. Finger tapping is widely used to assess motor impairment in Parkinson's disease. In fact, tapping the index with the thumb is a standard clinical test to evaluate Parkinson's disease severity. A study have shown that bradykinesia measured with a smartphone correlates with overall motor impairment in Parkinson's disease. Bradykinesia is a symptom of Parkinson's disease. Similarly, alternating finger tapping on a keyboard is correlated to subscores of the Unified Parkinson's Disease Rating Scale. So we propose to use rapid alternating finger tapping to assess motor fatigability. We have 2 hypotheses, and this is with the assumption that tasks are performed or completed at maximal effort. So the first hypothesis is that we expect to see decrease in grip strength when using a Handgrip dynamometer. Our second hypothesis is that we expect to see decrease in performance, that means speed, during the tapping task on the smartphone. We conducted a study in order to evaluate our hypothesis. For our study, we had a group of healthy controls. So these are persons with no known autoimmune condition. They do not suffer from fatigue, or they do not have multiple sclerosis, for example. The age of the participants in this group ranged between 20 and 55 years old. The size of the group is 35 participants. We had as well a group of MS patients with the group size of 20 participants, age ranging between 20 and 62 years old. This disability score of the patients ranged from 0 to 8. So our study had the following conditions. We conducted the study in a quiet environment, that means an office room for the controls and a hospital room for the patients. First of all, we introduced the task to the participants, and we allowed the participants to get familiarized with the devices. That means the Handgrip dynamometer and the smartphone tapping task. We ask participants to conduct the task with both hands, and between each of the tasks, we allow participants to have a resting period of 3 minutes. So for the baseline approach, we use a Handgrip dynamometer. We use the Jammer dynamometer that we can see here with the companion tablet application to record the handgrip strength. We ask participants to perform maximal voluntary contraction for 30 seconds, and we record the strength every 3 seconds. Now I'm going to show you a little video so that you can see the interaction with the handgrip. So basically the person is sitting straight. They perform maximal sustained contraction, and we can see on the screen of the tablet application that the values are being recorded. Now for our approach, the rapid tapping task on the smartphone, we can see here on the right side the user interface. We ask participants to alternate as fast as possible the index and middle finger on the screen. During the task, we record all the touch events with the corresponding timestamp. We use this data to extract the touch duration, that is, the time that the finger stays on the screen during each tap. The stop condition for our task is to complete 250 alternating finger taps. So now I will show you a short video so that you can see how is the interaction with the tapping task. So the person is sitting, performing the rapid tapping, alternating finger tapping on the screen, and the person can see an avatar moving while performing the task. So now let's talk about the data processing. For the handgrip measurements, what we did is we took the 10 measurements and we did min-max normalization. We did this normalization for participants, so per participant per trial. For the tapping task, what we did was first to do outlier removal. We did a low pass filter, min-max normalization on the data, and finally we aggregated the data into 10 segments to have comparable data to the handgrip measurements. During our data processing, we introduced the concept of trial validity, and this is to make sure that the tapping task is performed at maximal speed or maximal performance. There are two conditions. That is, first of all, we expect to see a positive slope on the data. So as time progresses in the tapping task, we expect that the touch duration is going to increase. If the touch duration is decreasing, we understand this as if the person is just improving while doing the task. That means the person did not start the task at maximal performance since the very beginning. The second condition is that we expect no more than 50% improvements during successive segments. So here in this plot we can see a valid trial, we can see the normalized touch duration and how it increases in time. So by fitting a line, we can see that there's a positive slope on the data. Now here we can see an invalid trial. By fitting a line, we see a negative slope. So basically the person, as time progresses, is improving in time. This means the person is getting faster while performing the task. So now let's go to results. In this plot, we can see the normalized grip strength in orange. Each point in this plot represents a participant, and we can see the data corresponding to the different segments. So we can see overall, so in average, that the handgrip strength decreases as time progresses for the patients. Similarly, we can see that there's decreasing performance in terms of the tapping data as time progresses. So, and this is visualized here with the blue line. Keep in mind that we have plotted here 1 minus the normalized touch duration, and this is for you to have or to see a similar slope as the hand grip. Otherwise, the correlation would be negative. We see a similar plot for the controls. So for the tapping data and the hand grip data, we can see the decrease in performance. So overall, we have a correlation of 0.8 for patients and controls. So what we notice is that 215 alternating taps can be challenging depending on the level of impairment. So overall, patients took more time to complete the task than the control population. Therefore, we decided to look for alternative stop conditions for our task. So in this plot, I'm showing you the correlation of the hand grip with the tapping task. As we can see here, there's around 0.8 correlation between the hand grip and our tapping task for the full duration of the task. That is, completing 215 alternating finger taps. In the bottom of the figure, we can see the percentage of valid tries. So for the controls, that is 90% of valid tries, and for the patients, 63%. Now let's see what happens when the stop condition of the trial is no longer completing 250 taps, but rather 90 seconds. So we can see that the correlation remains the same, but the number of valid trials changes. The same we can see with 60 seconds. With 30 seconds, we can see the correlation stayed the same, but the percentage of valid trials is actually higher. Finally, with 10 seconds, we can see a bit of lower correlation and a change in the percentage of valid trials. So overall, we can see that the first 30 seconds of the tapping task is suitable to assess motor fatigability. So in this plot, we can see that there's a good correlation between the tapping data and the hand grip dynamometer for patients and controls. So we see that for both groups, there's a decline in performance, and both curve. So for the tapping task and the hand grip data, they show similar curve. So 30 seconds of rapid alternating tapping strongly correlates with the standard hand grip dynamometer. So now let's jump to the conclusions. Of course, more work is necessary in the future. First of all, we would like to explore other methods and analysis strategies, and especially to ensure higher rates of valid trials. There's a need for larger studies and in the wild evaluations within subjects comparisons, and this will allow us to assess the use of fatigability. Finally, we would like to investigate the relationship between fatigability and subjective fatigue. So we have presented a novel approach to assess motor fatigability on commodity smartphones. We show that there's significant correlation between the tapping task and the hand grip standard measurements. This is a first step towards measuring motor fatigability without having to rely on specialized equipment. And our method might help quantify fatigue and complement the current assessment through subjective questionnaires. So with this final slide, I would like to conclude my talk.